There has been an explosion in technology in radiology. Since the first discovery of the X-ray in 1895, just think about it. We have advanced imaging in CAT scan, MRI, ultrasound, PET imaging, digital imaging, with clarity that one could only have imagined years ago. For example, in breast imaging, we may detect cancer calcifications that are no bigger than a speck of dust.
3D mammography is so revolutionary because it significantly increases the number of small cancers I can find at the screening level.
So the difference between 2D or traditional mammography and 3D mammography or tomosynthesis is that 2D mammography is taken in one picture through all of the breast tissue compressed, and the tissue overlap can hide things. 3D mammography is taken in an arc, so the computer can actually make those into images that you can page through like pages in a book. So you can see through the tissue better to find those little cancers earlier.
And yet it decreases what we call a recall rate, is the number of people who truly have screening mammography and then get called back, usually for things that are not cancer.
So we find more cancers. It's proven in a large body of evidence, multiple studies. We find them earlier when there's more options for treatment, and treatments are less expensive. And we have less of those false alarms or unnecessary callback exams that increase patient anxiety and are unnecessary. So it generally improves on every point of mammography in breast cancer detection.
I mean, it's an incredible time to be a radiologist and a fortunate time to be a patient.